For 90 years, Episcopal Community Services has lived its mission of serving God by serving those in need through programs and services that foster hope, dignity, and independence. Last year, in San Diego County, we served more than 8,000 people. 2,300 of them were low-income children that we saw in our Head Start and Early Head Start programs. Our Para las Familias program provided children's mental health services to more than 250 children and their families. Over 4,000 people came through our drug and alcohol programs. And our homeless outreach services provided transitional housing and access to supportive services to more than 900 homeless individuals coping with a mental disability. I'm here today with Bernie Miles, who is the manager of our Friend to Friend program. We all know about the homeless crisis in San Diego, and ECS's Friend to Friend is on the front line of dealing with that crisis every day. Last year, we provided over 550 case management services. We helped 111 adults gain access to benefits to which they were entitled. We also helped 43 members of our clubhouse become employed and 45 gain permanent housing. At ECS, we employ a full-time quality program specialist who collects data across all of our programs. One of the systems we use is the Homeless Management Information System. Bernie, can you tell us a little bit about what kind of data we collect?
Sure. And in the data we collect, basically universal data elements, their names, social security numbers, date of birth. We also collect their services that they are accomplishing in the clubhouse, as well as the outcomes of those services as well.
And how do we use that data?
We share that data with the continuum of care, specifically the Regional Task Force on Homeless, so that we might get access to housing resources as well as other resources.
So we care about the data, but we also care about the impact of our program on the individuals that we serve. Do you have an illustrative story that you could tell us?
Sure. We have one client that has been a member for a number of years. She lived outside near the clubhouse and basically decided that she was sick and tired of living on the streets. We worked with her and another agency and finally were able to get her permanent supportive housing.
And we stayed in touch with her, I believe.
We have stayed in touch with her. She will come to the clubhouse. We will take her to the food bank to get food so that she can have food for the rest of the month.
We like to hear those kinds of stories. Thank you very much for this opportunity.